me okay? All right, good. I believe we were started at 11:10, so we'll go ahead and get this started. Thank you all for being here today. My name is Dr. Vance Ginn. I'm an economist here at the Texas Public Policy Foundation with the Center for Fiscal Policy. And today we're going to talk about how TELs matter for opportunity in Texas. So first we might ask, what is a TEL? Right, so a TEL is a tax and expenditure limit. So basically today we're going to talk about how spending limits could more effectively provide opportunity here in Texas. And therefore, if we're more effectively able to limit spending, how that can be brought back to the people through tax cuts and tax reform and things of that nature. And what areas do we maybe need to more effectively limit spending by? And one reason to do this is to provide opportunity. The best way to provide opportunity is through a job. And we've seen that here in Texas. Since December of 2007, when the last national recession started, Texas has added 1.4 million jobs. If you take the U.S. and take Texas out of the equation, Texas, the rest of the nation, just now broke even. I mean, in fact, they now employ 150,000 more jobs than they did since December 2007. That was the first time that they've surpassed what they were in December 2007 in November of 2014. Just imagine that, right? 7 years later, it took the rest of the nation to get above where they were in December 2007. So something's going on right here in Texas. And what we would like to do, the Texas Public Policy Foundation, what our panelists will discuss here today is, how do we take the next step? We have this Texas model that we consider here at the foundation of being the proverbial three-legged stool. One of those being low taxes, where we have no personal income tax. We have a good lawsuit climate, and we have sensible regulation. How do we keep taxes low? Well, to do that, we need to be sure that we limit spending. So what does our spending trends look like? Is this even a problem? Well, here at the foundation, we believe that it is. Since 2004, state spending is up 64% to $204 billion. Now, that doesn't mean a whole lot, so let's adjust it for population and compounded population inflation over this period, and spending is up 13.4%. That is a problem. That starts eating into the private sector. And it's growing more than just the increase in the state's population and the cost of providing public goods and services that we have here at the state level, driving up taxes and potentially threatening higher taxes in the future. And this is something that we're concerned about here at the foundation. And recently, so our current TEL is only on a small portion of the budget, non-dedicated general revenue, which is about 40% of the total budget. And so the spending limit is based on projected personal income growth over the next 2 fiscal years. And so the LBB, the Legislative Budget Board, met and they determined that the rate will be 11.68% going into the 2016-17 budget. So that'll be on non-dedicated general revenue. And so that's kind of the idea of what we have today. And is that the best metric that we should use? And that's something hopefully we can discuss as well. So if you compare this with what actual personal income has been, right? They're projecting over these 2-year periods, and I don't know about you, but it's difficult enough to project what gas prices are going to be over a week or two, much less an entire economy when you're looking at personal income. And so if you look at this black line, the solid line shows what the adopted spending limit was in each one of these periods, going back to 94, 95. And if you compare that with actual personal income, which is the dashed blue line, you'll notice that we've been wildly off each one of these fiscal periods. I've also shown here gross state product, which could be another metric of the growth in the state's economy, and also population plus inflation. So since 94, 95, population growth plus inflation has been below the rates that were adopted in each one of these fiscal periods. And so this kind of gives us an idea of maybe different metrics that we could look at when we're considering what we should base our spending limits on and the growth rate of the state's economy. So some potential problems, well, it's only 40% of the state's budget that our current spending limit includes. And so that gives the legislature some wiggle room in which they could, use some budget tools to get around the spending limit, which can be a concern from time to time. And then once again, based on personal income growth, that can be highly volatile over time. And so here at the Texas Public Policy Foundation, one of our recommendations, or our major recommendation, is a threefold solution to make sure that spending remains limited, and that taxes and fees remain low here at the state level. And for one, it's to limit the entire budget, or at least all state funds, not just 40% of the state budget. That way you can get around some of these budget tools, some called budget gimmicks, if you will, that the legislature is able to use. The second one is to base the limit on the lowest of three metrics, with the first of those being gross state product, another one being population plus inflation, and the third one being personal income. Let's use the lowest of these three metrics, and let's get away from projecting personal income of a wildly volatile, well, not necessarily volatile economy, but just a very large economy that we have that's very difficult to do over any 2-year period, much less a month or two. So let's use actual data. Let's use the 2 fiscal years immediately preceding the upcoming regular legislative session. And so that's what we did here recently, and you've heard a lot about the conservative Texas budget and things of that nature. I'll get to that in just a second. And then finally, we've been able to strengthen our spending limit by moving to a 2/3 majority compared to a simple majority, and kind of add more teeth to the spending limit that we have today. So what would that look like, right? I mean, what does that really matter? I told you a lot of stuff all at one time. Well, if we use this reformed TEL going back to 2004, 2005, that budget period, and uses compounded population growth plus inflation, okay? Actual spending there is the black solid line, spending $204 billion today. If you would use compounded population growth plus inflation since 2004-05, we would be spending $181 billion today, right? In this hypothetical scenario. That's $23 billion less that we would be spending in this current biennium, this current 2-year budget period, saving taxpayers $1,800 this year alone. That's real savings. I don't know about you, but I'd like to have an additional $1,800, more than $100 a month that could go to buy diapers for my 4-month-old baby boy, right? Or something along those lines would be helpful. And so this is where we can see real savings that can continue here in Texas to keep taxes low and to be that Texas miracle of job creation that we've had. So what's the path forward? And I hope that our panelists today can discuss some different issues that arise with spending limits. What we've offered here at the Foundation is the conservative Texas budget, where we used fiscal years 2013 and 14 to calculate population growth plus inflation of 6.5%. And so what we did was we just increased the amount of state funds by 6.5% to get an amount of $142.2 billion, and increased the amount of all funds to where we get by 6.5% to get $217.1 billion, where we consider these to be benchmarks for a conservative Texas budget when we get into this 2015 legislative session, and we're making those points throughout the session. And so today we have a great group of panelists. Appreciate you all being here. First we'll have Dr. John Merrifield from the University of Texas San Antonio, who is a professor of economics. He's been there since 1987. He's a prolific writer where he's published in many academic journals, and he teaches a fully online course of school system reform studies. So he does a lot with TELs, school reform, things of that nature. Next we have Representative Donna Howard. Thank you for being here. She represents the Texas House District 48, has done so for the last 8 years. Member of the Appropriations and Higher Education Committee, and serves as Vice Chair of the House Administration Committee. She also serves as President of the Texas Nurses Association and as a health instructor at UT. And finally, we have Senator Charles Perry. He's an incoming senator for Texas Senate District 28. He also served as representative for House District 28 for 4 years while operating a successful certified public accounting firm in Lubbock, Texas. Currently sits in the Senate Committee on Higher Education, and while he was in the House, he served on the Committee on Appropriations. Completed his bachelor's degree in accounting at Texas Tech University, so another fellow Red Raider. Also, I got my PhD at Texas Tech, so it's always good to see fellow Red Raiders around. So without further ado, I'll turn it over to Dr. John Merrifield. Thank you.
You know, when I registered today, I was told that we have these different themes for these sessions, and this is one of the Pursuit of Happiness sessions.
Yes.
So, change that title to Kiss and Tell. Much happy. All right, so why do we need a TEL? I can tell you from having worked for folks in Utah, by happenstance, that this is not a red or blue state issue. This is an issue of the fundamentals of what a lot of people call the sausage factory, namely the legislatures that exist around the country, where a combination of pretty darn awesome people keep producing crazy results. And I mean the awesome people part of that. I was at ALEC a couple months ago, and I met a bunch of legislators from all over the country. And I've worked regularly with, legislators here in Texas and also occasionally in Utah. And at the end of all of these sessions, I keep wondering, why do all of these awesome people keep producing crazy results? Well, it's the process. There's a bias in the process towards more spending because they have trouble agreeing what not to spend on or what to cut in recessionary periods. And because you can win votes by concentrating a few pennies from everybody into a few $1 million for a few sets of powerful folks. So it's not about let's get rid of the rascals, because the new folks, and I probably would be in the same group if I was a legislator, would have a very difficult time as part of a group trying to figure out how to prioritize a limited amount of money, and thus might hedge towards spending more money, or at least spending all the available money that the comptroller certifies every budget period, which results in ups and downs that are somewhat intolerable. So, as it says on my slides here, we have an issue of being able to concentrate a little bit of money from everybody into a several $1 million for a relatively fewer people. But you see at the bottom there, that means that we can buy votes, in essence. Cutting spending doesn't tend to win many votes because you have to cut it an awful lot for anybody to even notice it. So we want to avoid the need to cut, and you can't agree on what to cut. So maybe we better start up front with a limit other than just how much money there is to spend, which is what the comptroller provides as a limit. And so we need a prudent, of course the definition of prudent will vary, limit ex ante. That means before we get into the process and say, okay, we're going to spend 3% or 5% or whatever more money than we did last year. Now let's figure out how to prioritize it rather than oops, we want to spend a little bit more money than we have. How are we going to pull that off? Maybe we better raise taxes. Among the many reasons that we might want to do this, we might want to generate savings for investment for emergencies. Now we do that a little bit already with our Economic Stabilization Fund, which some people call the Rainy Day Fund or the Budget Stabilization Fund, but it's really all-purpose, which is a problem. We proved that recently because I think we're to spend some of the money on water projects. No, I don't think that's what a budget stabilization fund should be used for, is to spend money in boom periods like the one we happen to be living in on water. Maybe we should have a different fund that we create from surplus funds in good years that's dedicated to investment and spend most of it in off periods because that's when construction is cheaper, rather than to spend it in the boom periods when everybody wants to build something and construction prices are up. Another reason to have a TEL is to eliminate the fiscal stress of the roller coaster that we're on when the comptroller says, okay, here's how much money is in the account, here's how much you can spend, and that amount goes up and down wildly. And so we keep under the pressure to spend, we keep spending all of it, and then some in some cases. Maybe we want to slow down the rate of growth of government, and we won't get into how slow maybe we should do, but maybe we think it's too fast, and so we set the TEL at a slower rate than what we've been averaging over a long-term period. Maybe we want to shrink the scope of it, not just grow slower by some metric, but scale it back some. So let's get into some of the things that people call TELs. There's the one that exists in 49 states, annually balanced budget. Very diverse. Vermont doesn't have one, everybody else does. But it's very diverse in exactly what balanced budget means. It's a source of a fiscal roller coaster, right? Because money is up and down according to personal income, some states more than others, and the pressure to spend means that usually all of it gets spent at least. And so it goes up and down. As we know from a couple budget years ago, we spent way less than this time around because we were in a recession. We thought we had way less to spend. And that also puts us on an economic roller coaster if we insist on balancing the budget, because then we increase spending or cut taxes during boom periods, and we raise taxes or cut spending during down periods. And we know that revenue is pro-cyclical because it probably, in most states, it goes up more than the economy does in good times and down more than the economy does in bad times. And at the same time, we have countercyclical expenses. The expenses are up in down periods, and they're down at least somewhat, depending on how you define expenses in the good periods. Solution to make some of these balanced budget issues go away, you put a cap on spending below average revenue, and you allow for temporary debt. This is probably the thing we should be doing at the federal level, where you don't have a balanced budget requirement, and just grow spending steadily and borrow a little bit in the bad periods and pay it back in the good periods. At the state level, where we typically have a balanced budget requirement, let's cap it at below typical revenue growth and have a budget stabilization fund. Sorry for the abbreviations to fit it all on there. Rainy day fund, budget stabilization. And by that I mean a true budget stabilization fund, one where the money goes in during good times and comes out at the bad times to make up the difference between what the cap spending level is and how much revenue you have coming in. Not a fund like ours, which can be used to pay for water projects and is sitting there in case we have a hurricane, and maybe if the economy and the budget, the revenue is down, to keep spending growing at a little faster rate or not cut as much. Now, what should we have as the TEL cap basis? Well, ideally, it should be the tuned to the demand, persistent demand for government responsibility. Population plus inflation multiple, that's an important thing to understand, and also the fact that there are different populations and different measures of inflation. So we're not just talking necessarily the CPI plus the overall population rate. Maybe we think that a different population number is a better measure of the demand for persistent demand for state services. We could have personal income growth, but that tends to be pretty volatile. Hopefully we can get away from that with I'm an optimist with the TEL that we're going to enact. You see, the population plus and multiple takes account of, gosh, maybe population plus inflation is too slow. Maybe there are all these federal mandates we're going to have to meet, and we can't possibly keep the budget only. Well, make it population plus inflation times 1.2 if you're going to do that. That's a lot less volatile than personal income growth. And the biggest issue of all probably is, should it just be a law or should it be in the Constitution? I would argue the latter, because otherwise the budget resolution just trumps the limit and it's practically meaningless, other than maybe as something to use in the campaign for my opponent has increased spending way above our TEL, et cetera, and you have something to lean on, but beyond that it's not all that meaningful. Now, another issue is, should we annually rebase? What does that mean? That means to base the next year's cap on how much you spent this year, okay? Or should next year's cap be based on how much the cap was this year, which maybe you didn't get to? Okay, so that's the difference between annually rebasing or having steady increase. If you annually rebase, that means that any time you fall short of the cap, you permanently, for all time, have reduced spending, which isn't necessarily bad, although it creates some political durability issues that in Colorado cause their TEL, their TABOR, Taxpayer Bill of Rights, to be severely weakened. So you have to take into account political as well as fiscal and economic issues in creating the TEL. If you make it too stringent, the voters will reject it. So don't overdo it. Okay, and then there's the issue of slack. That says, gosh, if next year's limit is based on how much we spend this year, we better spend right up to the limit this year. Okay, so slack is better, except for the fact that if there is slack, you have more ups and downs in the spending, because in some years you won't have any. So if you have a steady cap increase, in other words, next year's cap is based on this year's cap, not how much you spent, then there will be some slack occasionally, because there's not this paranoia that, hey, we're reducing spending for all time if we don't spend up to the cap this year. But you'll have a lot more volatility, which is a bad. And as I mentioned with the Colorado example, up till 2006, Colorado had a rebased TEL. Next year's spending was based on population and plus inflation over this year's spending. Now their new TEL is based on, next year's cap is based on an adjustment of this year's cap, never mind how much they actually spent. California is now gutted. Ginn amendment is an example of one that's the cap for next year is based on the cap for this year with an adjustment. All right, so some early insights. As I mentioned at the outset, this is not a red state, blue state issue, other than the states, the so-called red states. And I'm not sure how did we get labeled red states? And that used to mean communism. Anyway, some intrepid importer that wanted to confuse us did that some when ago. So this isn't a red state, blue state issue. The two states that I've worked with the most in my research, which is mostly national, based on all the states, I see it, has been Utah and Texas, and those are famously conservative. That's a line right out of the Wall Street Journal for Utah. And I'll tell you, they spent like, darn, I was about to say drunken sailors, but Ronald Reagan once reminded us that they're at least spending their own money. So we don't want to insult the drunken sailors. But anyway, they increased spending massively up till 2008. They spent it, I mean, it was all Republican, governor, legislature, the whole thing, like us. But they spent like crazy. It's the process, okay? So we may be more likely to be smart enough to enact a TEL, like compared to California, a so-called blue state. They might not be, because it's all Democrat everywhere there, but we need one just as badly as they do. Well, not quite as badly, almost as badly. And it needs to be in the Constitution, otherwise it'll just be overridden by the budget resolution. Not personal income, no. If population plus inflation seems too slow, make it a multiple of some population measure plus some inflation measure, which could be carefully chosen, as long as it's not chosen alongside making the actual budget. It's ex ante up to that point. Okay, personal income is too volatile. Use the rebase. One of the things that I've discovered in my research is one of the ways to do some of the things that we want to do, namely get the legislature to pare the fat every once in a while, is to have some of these ratchet down periods that you get when you rebase. So one of the thoughts that I had was, why don't we have it be a little faster than population plus inflation, be the cap, but allow it to ratchet down in periods where we can't meet the cap. See, that way, long term, we keep up with population and inflation or close to it, but every once in a while we get some push to cut the budget, and then they have to go and find some fat, which there always is, and do that. Okay, so but anyway, that research is still in flux, and this is one of the great forums where we prove that what everybody knows is a lot more than any of us knows, so we can further improve upon that potential insight. Okay, so you offset the ratchet effect of some years you don't meet the cap, and that reduces the cap for other periods by having a higher cap than you otherwise would. States, all of them need a budget stabilization fund and an emergency fund, separate funds, so that when we meet the demands of slower growth periods, right, spending demand for is countercyclical, we don't encroach upon, hey, we need some money in there in case there's a hurricane. Okay, so, and then don't ignore the political durability issues, because if you do, you'll be like Colorado. If you make it too stringent and too tight, the voters will overturn it or weaken it. Okay, so take account of that when you build your TEL, and thank you very much.
All right. Thank you, Dr. Merrifield. Now I'd like to ask up Representative Donna Howard.
Well, it's good to be here. I was asked, I think, here to provide a different perspective, and hopefully that means we're actually going to be talking about some different ways to look at this and have some real discussion about the pros and cons of some of the different suggestions. I think sometimes what happens when you have a lone person like myself up here representing a different perspective, that maybe all that will end up doing is solidifying predetermined assumptions and beliefs about this. So whatever comes out of this, I am here to talk about a different way to look at some of this. One of the things in the program that introduces this particular panel states that state spending has increased by 13.4% above population growth plus inflation since 2004. This would be a point of debate, again, I would say, and it depends on how you use the numbers and how you calculate your numbers. And according to the fiscal size-up that the Legislative Budget Board, or nonpartisan budget board at the Capitol, does, their fiscal size-up states that general revenue adjusted for population and inflation over the past 20 years increased 2.5%, and that since 2002-03, it's actually decreased by 3.4%. Again, we could have some honest debate and discussion about how we get at those numbers, but I think it's important that we do, and that we don't make assumptions that whatever number is presented to us is necessarily the correct number. There's always ways to work with mathematics. There are multiple factors, of course, in managing our budget, and I think that we need to have responsible rhetoric around this. Facts are not always necessarily the truth. And what I mean by that, to give you an example, in the budget cuts that were made in 2011 to public education, we had a lot of rhetoric surrounding that from a variety of perspectives. Some folks said, well, the state actually spent more on public education. Others said, oh, no, the state cut the funding for public education. And in fact, both were correct in terms of some facts. But you need to look at the bigger picture to understand what it really meant. Take everything into account. Do not take these numbers out of context. So what I did is I followed up with the Legislative Budget Board and got a bunch of information about this, tried to put together all the data, and was corroborated by the Legislative Budget Board, as well as got PolitiFact checked, as a matter of fact. But the fact is that the previous legislative session, we had federal stimulus funds coming into the state that the state accepted. And we used some of those funds, those federal funds, to pay for public education. So we swapped out some of our state funds and plugged it in with some federal funds that were only one-time federal funds, as you recall. Those were one-time funds. But we used them for ongoing operating expenses. So when the next session came around, those federal funds were not there, and we had to reinsert the state funds. Well, by doing that, if you just look at the raw numbers, yes, general funding, state funding increased because we replaced the funds that we had substituted federal funds the years before. You get what I'm saying here. So indeed, we spent more. But if you looked at the total package of what was spent on public education, we were actually spending $5.4 billion less, which, just to make it simple to talk about, we said was an average decrease of $500 per student in the state of Texas. Now, that was on average. Some had more of a decrease, some had less of a decrease. But the fact is we really did decrease the overall amount of funding for public education, even though we had increased our general revenue spending. It's all in how you say it. And that's what happens. I mean, to your point about politicians, we do typically state things a lot of times to support the opinion that we're trying to get you to believe, if you will. I'm trying to think of how to say that. I don't know how to say it nicely.
There ain't no better way.
Everybody knows what I'm talking about. So what I'm asking for is that we have honest and responsible rhetoric, and I'm asking that of myself. I want us to talk about what are the facts here, what are the real numbers, and let's come to agreement on that, and then we can debate the ideology and the philosophy about what we're trying to do here. So we only have discretion as appropriators over about 17% of our budget as it is, and that actually includes higher education in that discretionary funding. And I think most of us would not want to line item get rid of higher education. So it's really even less than 17% that we have discretion over. We are already limited in how we can address that 17%. Our hands are tied pretty securely in how we address that. You've already heard some of this. We are limited by the Constitution to be pay-as-you-go, which is basically our balanced budget amendment. We are limited with what we're talking about here today on spending on our non-dedicated general revenue based on the estimated rate of growth of the state's economy, and that was determined by our Legislative Budget Board in November, of the 1st of December actually this year, to 11.68%. Plus there's a couple of others that are not as much of the discussion today, but welfare spending for TANF, for needy families, that is capped at 1% of our budget. And then there's a further constitutional limit on us that has to do with a new authorization of debt service. So we have certain constraints that are already there. I would agree with TPPF and what they've put out about increasing transparency. As I'm talking about honesty and transparency, I think that's huge. And I don't see how anybody could debate that. I do have some legislation that I am going to be proposing this session that I think actually addresses that to some extent in terms of having more frequent revenue projections. In other words, at least quarterly revenue projections, so we actually can keep a better handle on what's really going on. We are a part-time legislature that creates a 2-year budget and does not have regular revenue estimates. And I think that that is preventing us from being more responsible and honest and transparent about what's going on. I also want to look at something that Florida has done that has to do with a long-range plan for revenue. So in other words, we have a statewide plan for water. We have a statewide plan for closing the gaps in higher education. We have all kinds of statewide plans that look multiple years into the future. This is some goals we have, where we want to go. But we don't have the fiscal plan to go alongside that, to talk about, well, if we're really going to be trying to achieve this by a certain point, what is that going to cost us? We need to be looking at long-range fiscal planning as well, I believe. So I do have some issues with using inflation and population growth as our governors on spending. What the state buys, for one thing, such as concrete, is much different than what consumers buy, such as eggs. And as I heard some potential looking at some other metrics, which I think is good, because the CPI really is not predictive of what the state buys necessarily. And also, as Governor Dewhurst pointed out in the recent LBB hearing, inflation and population growth are different units of measure that have a multiplying effect rather than an additive effect. So the calculation that I've heard proposed anyway is not mathematically accurate in terms of just adding population growth and inflation. Also, it assumes the current funding level is the appropriate baseline from which to work, which ignores, and again, I heard some suggestions, I'm glad of that, ignores the changing demographics and needs of our state. But more importantly, from my vantage point, it ignores the fact that our baseline budget is not currently fully funded. So, in the 2006 property tax swap that we had, that some of you that have been around and paid attention to that, when we reduced school property taxes, compressed them from $1.50 to $1 in 2006, which was the first vote I was involved with when I got here, which is actually, I'm coming up on 9 years, by the way.
Oh, okay, all right.
But,
change that.
yeah, well, I came in a special, I got thrown in, this was the first thing I got thrown into as a new legislator, was the margin tax. It was a very contentious, very difficult thing to start off with at the legislature. But the point was that our property taxes, as they are now, were extremely high then, and people wanted relief, and schools are where we spend at least half of our property taxes. So the business community got together with a bipartisan committee that the governor appointed and came up with some options, as you know, that a lot of people don't like now. But the fact is that we did vote to reduce property taxes for schools by 1/3. That cost the state $14 billion to make that swap for a 2-year budget. And we covered that to some extent with an increase in cigarette taxes and an increase in the change in the used car sales, and then the main one, the margin tax. Well, bottom line is, as of today, and it's always underperformed, but as of today, if we're going to go with that $14 billion, which the comptroller's office says is a reasonable number to still go with, to cover that compression we made, the swap we made, we are covering about $3 billion a year, so $6 billion biennially, which means we have to get about $8 billion more from GR somewhere. So we're not, I mean, we're counting on GR to do that, but that's a pretty big hole to deal with in our budget. Not to mention the fact that we underfunded Medicaid by about $1 billion, and we're still using funds that are being collected from you for a particular purpose, not spending it on that purpose, and instead holding that money back to certify the budget. $4 billion. So from my vantage point, we don't have a fully funded budget to begin with, to use as a baseline. And I think to be responsible, we need to look at what are we actually funding now? Do we think those services need to be provided? And if so, we need to fund them. So if you get the math correct about how to compute this thing, and if it's simply a calculation that can be applied to a baseline that somehow people can assume is a correct baseline, then why would you not just plug this simple inflation and population growth factor into a computer and pop out what the budget should be? Why do you even need legislators to talk about this? Why do you not just turn this over to hell? This is part of the issue I'm trying to understand here. If this is just a simple calculation that has no nuances to it, that there's no changes in what Texans need or what Texans expect, then why even have us there doing it? Maybe that's a good question for you. Maybe you don't want us there. But the fact is, I think it is more nuanced than that. I think it does require more thought and deliberation, and I think once we get our numbers down to where we can agree on those, that's where the real debate should be. What are our philosophical and ideological differences, but let's base it on the same numbers. Thank you.
Thank you, Representative Howard. And we definitely agree about budget transparency. That's for sure. We need more budget transparency. Next up, Senator Charles Perry. Thank you.
What time are we supposed to be done with this?
12:20.
Okay, because I'm giving the prayer, I think, so they can't start without me.
Oh, okay.
So I just want to make sure.
We have some time.
Hey, it's great to be here. You know, I'll say if it wasn't for people, it'd be easy. I'm going to take a little bit, maybe not a whole lot different path, but just a little different perspective on how I see the budget. Serving on appropriations is a very eye-opening experience. And it has great people, and I really appreciated working with Donna, and we actually came together on a couple of things that maybe will get done this next session. But, you know, I look at the budget this way. You hear a lot about economic engines and drivers in this state, and truthfully, it's always in the business context or even in education or higher ed and the economic. It's not state spending that drives it. It's the consumer. The ultimate economic engine in any economy that is based on free market is the disposable income in the consumer's pocket. They are the ultimate decider of what they demand and who should provide it by choosing to service that need. So always, as I go through the budget, I look at it, and I think Phil Graham said it was Dickie Flatt's test. Is Dickie Flatt's going to agree with that if I take it out of his pocket? And I'm not saying that there are not issues that government should absolutely be a part of. But where I see the state budget has gone a lot is we have a lot of convenience legislation, is what I call it. We had a core function that state government was belonged in. And over layers and layers and layers, we've added more convenience to help do that a little bit better because we just didn't like the work it took to do it on its front end. So there's opportunity throughout the state budget, in my opinion, to always go back and look at and see if the core function still demanded, and if so, are we doing it the best? So with that, I'll kind of open it up in that context. I do believe that there ought to be a TEL. We have multiple layers, but we kind of jockey between them because they're a little subjective in their quantifiable tech. You know, you kind of get to move around a little bit as a legislature. But here's one thing I would say, and this year's budget cycle is absolutely a point to be made. You can have a population plus inflation factor built into your TEL, but in the state of Texas, we added 1 million lives to the biggest driver in our state budget this year in Medicaid, and our population didn't go up. Within the same population, our demographics added 750,000 lives to the Medicaid rolls without Medicaid expansion. So if you're using a population inflation factor that doesn't look at what's driving your budget, it's kind of like we're trying to solve a problem with only including 40% of the problem. So you've got to get down to the nuts and bolts of what is driving your budget. And if it's driving it by Medicaid caseload and you use a population for the inflation factor, but the population that just moved your caseload up $3.5 to $5 billion is not in your factor, then you're always going to have this contention and probably inaccurate, as I think Representative Howard mentioned, problem you have. So that's, I wish it was as simple as just one thing. We are a very diverse state. Our demographics are extremely unique. Economic regions are different. And with that, you'll never find this magic bullet. But I do agree population inflation is probably the right way to move towards if you are allowing for those multiple drivers of the budget as you go through it. Because I can tell you, if I look at the growth in the prison system or the decline in prison system, it's 5,000 people. When I started in 2011, I think we had 157,000 in prison. We got 150 now, something like that. If that's my, quote, growth factor for population determination, I'm going to miss the budget because it's the million lives we added in Medicaid that's the problem. So that kind of brings me up to a little bit of a different perspective. We've got to always, as legislatures, remind ourselves what core functions are, and therein lies the political ideological debates. All of us can agree probably education. We're constitutionally bound for that. We have inherited a safety net and entitlement system since the 60s when Medicare came in and Medicaid came on board. And so now it's a big part of our budget. It is not performing. It is under-delivering on quality. It is probably actually putting people into a health risk because it doesn't meet the need that's there. We've got to get out of that. Somewhere or another in this session, we have to have the healthy debate as what does our Medicaid system look like going forward. Now, do we walk away from Medicaid funding today from the federal government? Absolutely not. But we have to ask, and Texas carries the stroke, the federal government, we need your program to be administered this way or we will go broke as a state doing it. And use the political leverage that comes with, do you want to be the federal government that has Medicaid go broke in Texas on your watch? And we're big enough, to, I think, to yield that sword. And there are private market solutions. But we've got to understand that anytime you put a taxpayer dollar behind an initiative, the cost of that initiative just tripled. Private sector sees that as instant lottery. And I don't know how you put caps on that or how you monitor that, but in our transportation needs, you know, I hear $5 billion, $5 billion, $5 billion. And I'm not disputing the fact that we have road issues, but I know that part of that $5 billion is inflated by the very fact of a bunch of lobbyists standing at your door going, you got to do this because if you do this, then they have work for the next 20 years at an exaggerated cost because the taxpayers got behind it. Because you know what? Everything from the government's free, right? Everything from the government didn't cost me a dime, right? Well, that's wrong. Economically, in our state of Texas, we have a very diverse revenue stream. Talked about property taxes a little bit. You know, the school 206, I keep hearing this. Truth of the matter is appraisal creep took away what we did within 2 years. So this shortfall that you keep hearing, and here's the math. We actually had to reduce school funding in 2011 with the deficit. Today, we're about $947 million short of what that would have been. I'm not suggesting to that's painless. I've got superintendents that drive buses and teach classes. So, but there is room for work in that. But at the end of the day, this property tax deal, this, you know, the way the budget works, you know, it's pretty complicated. They really made it difficult to follow by design. But at the end of the day, it's about $947 million short. But the property tax appraisal creep fixed that quickly, very much so. So you hear a lot of numbers. I would agree that there is probably on the population plus inflation number, lots of debate on there. I've done that calculation. I don't see a different 13% number. I see a lot lower number. So we're not been non-frugal with state resources. We've done a pretty good job of doing that. So I think at the end of the day, more than importantly than how we limit and what processes we use to spend, it's a question of should we be spending it? And if we're going to spend it, are we going to do it the absolute most effective way? And are we the provider of that service? Should we be the ones doing it? And we always got to kind of test ourselves. And if we don't do that, then we end up with a $200 billion budget that has layers upon layers upon layers of special interest, all providing worthy services. And I'll give you one example. Our Medicaid rolls are expanding. It is a budget killer. Our federal government's budget will look like the Texas budget with respect to welfare entitlement if we don't bend the curve. And you have to change people's behaviors to bend that curve. You have to incentivize people to work instead of stay out of work. You have to incentivize people to get health care if they want to participate in the process to get health care. So all that say, if we don't go down this road of bending those issues and it's you know, it's individual behavior that's driving our budget. And we've got to begin to make the tough calls that forces people back into those decisions. As painful as it'll be on the front end, we owe it to the next 2 generations ahead of us to have made those calls, because our federal government's budget and the state budget looks a lot alike with respect to entitlement, welfare, and safety net programs. Will consume it within 30 years or less. I may see the day where our state budget has no other money other than health and human services, and that is not the state that we should leave our kids. So with that, I'm willing to take questions. Thank you.
Thank you, Senator Perry. At this time, I'd like to see if any of the panelists have questions for one another, clarification, or anything of that nature. Do y'all happen to have any questions for each other? Or?
Not yet.
Not yet. All right. I'll turn it over to the audience then. What questions do you have? You please raise your hand and wait for the mic who are recording all this. So right back here, please, sir. You. Yes. Yes, ma'am. Thank you all for a lively discussion on TELs, which can sometimes be a little difficult to make a lively discussion on. So, all right. Yes, ma'am.
Hi. What I want to ask a question about is the state pension fund, because that wasn't mentioned today. And when Bill Gross's fund fell in California, Texas pulled a bunch of money out of there, and I assume at a big loss. And you know, California got in big trouble because right before people retired, they boosted their pay so that they would get more pension. So I would like whoever is knowledgeable about it to please address what happened to the pension fund when it was pulled out of Bill Gross's fund. How much money did they lose? And what percentage rate is the projection on the pension fund? Because the reason I mention this is because from my own reading, even though I don't know what the inflation rate was you all were using under that 6.5%, but if the inflation rate is maybe 2, and it might be less than that according to the Fed, then I understood that most of the pension funds for states in the country were rating it every year at 8%, and that was their goal. So could somebody address that?
Why do you leave me? I'll just say it in a generic term. I don't have that specific, but I can speak to TRS. I do know a little bit about the TRS system, and it's been ran where it has outperformed the market, or at least better than the market, for years. It's done a very good job. But I would make a caveat: all pension funds, all defined benefit funds from the state, local, and county levels out, all 50 states are underfunded, pretty much guaranteed underfunded. So that is an issue that we as a state of Texas, I think, address every session. We look at it, look and see where it's actually sound or not, and try to make adjustments. But specific to money coming out of a pension fund in the California arena and what that was, I'm not that familiar with that particular instance. So, but I will tell you this, TRS was modified last session significantly to put it back on an actual trend going up. It's not there today as far as where I would like to see it personally. It needs to be around the 90% mark. It's about 80, 81, 82% funded. Actual sound means, I believe, 30 years out. And so we've got that TRS fund moving back up, understanding 60% of that fund's value is market driven. So it can go up and down pretty regularly, but there's always tweaks to be made. I do believe ERS in Texas has to be tweaked to manage the benefit structure, if you will, to where people can't quit at 52 in the TRS system. They get penalized if they're below a certain age. We've got to start continuing to make those tweaks to push that out, but I don't have a specific investment issue.
The fund, like many of the other funds, their internal rate of return is estimated at 8%.
Right.
When the whole economy of Western Europe and us is at an inflation rate that's dropping like a rock, the whole thing is realistic, and you would have no idea
Right.
whether your fund is unfunded or not.
Sure.
That's the number. Look at 8%.
Right.
It's just crazy. It must have been set up in the 80s when the rates were high.
Right, and we do a pretty good job of those reviews. Now that doesn't, I always like and say just because I know didn't mean I fixed it, but it is at least on our radar, and we do make steps, I think, to always manage. And you do it incrementally. You've got teachers I'll tell you the biggest challenge in the next session is $873 million deficit in TRS care. It's the retired teachers' health care. State employee health care is also underwater, I believe somewhere around $200 million number, but I'm not for sure. And that reflects not a state issue, but that reflects a national issue. Our healthcare system is going to bankrupt under its current setting and the way it's functioning and the way it's operating. Because again, one of the denominators is when government gets behind funding something, i.e. higher ed, the more funds that were available, tuition costs went up. Healthcare, same way. The more payer sources you have, the more cost goes up. So, but our healthcare system in the state of Texas, under our employee and our TRS healthcare, is underwater.
All right,
Yes,
thank
sir.
you. Yeah, question over here.
On the pensions, in the private market, basically predefined pension benefits have been eliminated because all you're doing is pushing the cost down the road and it's being underfunded. Has Texas thought about constitutional amendment to migrate away from predefined pensions for public employees and move them to a predefined payment for pension funds?
I'll try. And I'm not prepared to talk about pensions either in terms of in depth, but we did have some studies done this last session of both our teacher retirement system and our state employee retirement system and looked at a variety of options and what the ultimate cost would be. And it was determined that the system that we have now is, in fact, even though it's underwater in lots of ways, is the most cost-effective that we could offer. Now, there could be some debate about that, and I can't really go into that because I don't know that at this point. But as Senator Perry is mentioning, we do have issues with our health care part of the package, more so than the retirement part, although with the that's with the TRS, with the teachers, but with the ERS, we actually have, we've had greater issues with our retirement part of the package. And it has to do, again, it's your own perspective here, but it has to do with the lack of investment on the state's part of fulfilling our end, in my opinion, of the bargain that we made with our employees as to how much we were going to be putting in. And we have made a lot of adjustments. Last session, there was a lot of work done by your predecessor in particular to make sure that we did get more toward an actuarially sound program, and in fact we're able to give a COLA to the teachers because of the fact that it was actuarially sound, because we are prevented from doing so otherwise. So we do need to be looking at options, obviously, and the ERS people have already been looking at a lot of them because there's apparently going to be some changes in GASB that are going to impact this and make them even make the whole even greater with the new rules that are coming forward. So it's a big challenge for us.
Do you know of any predefined pension fund that has been actuarially sound?
Who's on the mic?
I'm a CPA by trade, and when I first started practice, every doctor had a defined benefit plan. And he'd put in $120,000, whatever the contribution for the year was, but then he dropped it because it was mandatory funding to meet the defined benefit plan obligation. Unfortunately, the state and the employee, and as of last session, now the district is participating. See, we went for years where the school district never put anything towards teachers' retirement. So we got all three schools now at least putting money in. The study that was done after you consider the match and moving people to the FICA system, i.e. Social Security, and because if you take them out of the teacher retirement, you pretty much put them into Medicare, Social Security system, which may not be a bad thing, but the dollar savings to the state wasn't there. It's about the same funding. Where we've gotten in trouble is political courage failed again in many years past. When teachers used to have a 90 service rule, meaning age in service equal 90 to be able to retire, and we lowered that and lowered that and lowered that, and it was down to 80, I believe, is where it was at. And I am going to entertain and interject at the peril of myself politically that we get back to the 90. Those are things that don't cost anybody any money, but puts that plan on what it was intended to do. And the truth of the matter is, defined benefit plans don't allow for different benefit payouts. And you hear that argument, I want it, and I say, well, we can go to contribution plan overnight, and you can have all that subject to market and more money in your plan probably. But the answer to your question is the numbers didn't support a savings. Now, I think long term, we're still going to be underwater because you can't meet the requirements of defined benefit plan. The only way to do it without more money is change the benefits. And I think 90 service rule makes sense, and that's what it used to be. And we've cheated the system, honestly, to do that. We've got to have the same discussion about health care.
All right, thank you. I have a question right over here. One second, please. Thank you.
Thank you, and thank you for all of these wonderful comments today. Professor Merrifield, I have a question related to the Colorado Tabor system that you mentioned early on in this discussion, and you mentioned the change that occurred in 2006. Could you explain what went wrong with Colorado's system, and would you tell us if there are any states that you would hold up as a model for a state moving towards a population inflation spending cap?
Well, there are no models because there are very few effective TELs around. There are a lot on the books, but none of them seem to constrain spending very much. But what happened in Colorado is, well, one thing, a mistake that they made, according to the simulations that I and a Coloradoan are doing, is that they didn't include a rainy day fund or a budget stabilization fund in their taxpayer bill of rights. That's what the acronym TABOR stands for. So the taxpayers came to love the TABOR in the late 90s when they got rebate checks every year. And I guess that's the reason they didn't enact the rainy day fund, because although there was occasion mention of it, is because they didn't want to give up their checks. But then came some rough economic times, and the state had to do some serious cutting because there was no rainy day fund to backstop any of that downturn. So because of some of that fiscal pain, there was a referendum which narrowly passed in November 2005 that said, it unfortunately didn't create a rainy day fund either, but what it said is we're going to take a 5-year time out and let the state spend whatever to establish a new baseline. And then after that, our TABOR will be based on the previous year's cap rather than the previous year's spending. So they eliminated the rebasing that notion that they had. But the bottom line is that in rough economic times, there had to be severe spending cuts because of the TABOR, and that those spending cuts permanently ratcheted down how much spending there could be in subsequent periods. And so they mustered enough political constituency to pass their referendum in 2005 for that 5-year timeout, and then the loosening of the cap thereafter.
Great. We have another question right over. Anybody else? Okay. Question over here.
Instead of placing a TEL on the overall state budget, I wonder what you think about putting a TEL on departmentals and agency budget, but based on certain key performance indicators, measures, benchmarks, and maybe cost effectiveness of their performance. What are your thoughts about that?
Well, we effectively have established, and I think properly so, if you've ever sat through an appropriations subcommittee, you hear all of the metrics that we have established for particular agencies. For instance, we had a metric that we wanted to reduce the backlog of mental health cases. We had a huge backlog, and we gave that metric out there, and I think as of today, we are current now on pretty much our mental health case log. So we do define very prescript, if you will, by agency what our expectations are. And the LBB does a good job of coming back and reporting according to what our objectives were, where did we hit. The question becomes, I did a zero-based budgeting again. That comes up every session. In appropriations, the first question you have is what did we spend last year, or what do we spend last budget? And that shouldn't be the question. The question is this service still needed? Did we do it the way we wanted? Did we get the outcomes that we sought, as you suggest? And if so, can we do it better and more effectively and efficiently? Not what did we spend last year based on the premise that, well, whatever it is, we got to add to it. And that's where we get in trouble too. So zero base kind of draws it back down to zero and makes that agency come in under those objectives and justify every item on that budget that they're asking for.
Dr. Merrifield?
Yeah, I'd like to respond to that too. there's a trade-off between whether you should have the TELs be agency or function specific or not, and this sort of addresses Representative Howard's issue of why have legislators. Why have legislators is because you want to have a set total amount of money by whatever measure, either including the current one of how much money do we have in the account. And then you want to have the legislators prioritize that sum of money. And it may be that the prioritization says, let's cut taxes. But it may be, hey, we spent too much, or we don't need as much for whatever this year, but we need some more for something else. So the priorities change. So you have an overall amount of money that's growing slowly, and the taxpayers say, yeah, I'm willing to allow that total amount to be spent. And then we have our fine people, and I mean that literally, somebody willing to work $600 a month to do all of this stuff and get beat upon and criticized and the long hours and still try to figure out how to make a living. I trust them to allocate, to prioritize a set, slowly growing amount of money. Where I have a little less trust is if the cap isn't there to keep increasing the amount of money that they spend because they can't agree on what to cut. Because that's tough. That's why they're see a presidential debate and ask one of them, well, okay, so you think we got to cut spending? What are you going to cut spending on? Have you ever heard an honest answer to that question? Okay, so maybe we should shoot for slowly growing spending, be realistic about that overall, and let them behind the scenes figure out exactly how to spend it.
All right, I think we have time for one short question. Right back here in the back.
My question is either to Perry or Howard. My question has to do with when is the government going to bite the bullet, and let's go to a defined contribution plan instead of a defined benefit plan. If we don't get there, we're going to go broke. You see that? If the corporations haven't done that, they're going into trouble consistently. You can look at General Motors, you can look at the airline industry. We have to do that. The governments that do not do that are going to go broke. Maybe that's a discussion for another time, but we got to bite the bullet, and why will you not do that?
Well, I think we addressed it a little bit earlier, that the cost of doing it at the current level didn't change it. But also I'd say this GASB pronouncement that Representative Howard mentioned is fixing to put a liability. See, a lot of it, you're talking about unfunded liability, unrecorded liability. It's not in front of the state legislatures nor the communities. And so, being the CPA that I am, this is a rule coming out of my organization, GASB's Governmental Accounting Standards for Accountants. And they have said enough is enough, because we have Detroits all over this country just waiting to happen. Houston's have their issues, same issues. So they have said that you will, as a taxing jurisdiction, i.e. school districts, community colleges, state organizations that have defined benefits, are going to now be required to disclose that, not in the back of a financial statement footnote that nobody read, but on your balance sheet. So what is the significance to that? Where I thought I was whole, I was doing well, I got money in the bank and I got bills paid, I didn't want to tell everybody that I had a $2 million unfunded liability on my pension plan. So that's going to be the first step, if there is any discussion or change to define defined benefit, to remove it. That'll be an eye-opener for so many people at so many levels that there may begin a political discourse and discussion that says, we can't do this. What is our alternative? But that liability is fixing to pop up on every balance sheet on every school district in this state. And it should. As painful as it is, it should. But I also got to remind people, I love my school districts. I have 146. I have 51 counties. I have every known issue to this state in my 51 counties, promise you, not only on school districts. But I also know that when you look across the board in my school districts, they have unappropriated fund balances. They have large sums of cash. Some of them deservedly so. They have bond requirements and things. But what I'm getting to is it's a little bit disingenuous to come scream at the state that we have no money for public education when they're sitting on billions. I think the last estimate, $12 billion in cash on their balance sheets. And then not to have the unrecorded defined benefit liability to offset it by $2 billion on their balance sheet. So I like transparency, and I want GR to stand on its own. We do so many smoke and mirrors. To me, if we got everything done in the GR that's core functions, we may have to have more revenue. I don't know, but at least I would know. But I like the idea that Gatsby's going to put this out there to where we all as a community and a state will know this is the defined benefit liability. Are you upside down as a district? Are you upside down as an organization? Are you upside down as a state? The state needs to go through the same process. It's currently in the CAFR in the back. So you got to dig through and understand it, but it's there.
Thank you very much. As far as the Texas Public Policy Foundation, on our agenda is to move to a defined contribution plan instead of a defined benefit plan. It's one of these issues that we have, this generational accounting that's even hurting us at the federal level, right? As all these baby boomers retire, you're going to see that cost increase. And so hopefully we are able to find some common ground on able to make some reforms dealing with pensions. So thank you for a lively discussion.